We're going to continue our sessions here with Dr. Hilary Brown, who is a PhD Associate Professor, University of Toronto, Adjunct Scientist at Women's College Hospital. Dr. Brown holds a Tier 2 Canada Research Chair in Disability and Reproductive Health. Her research program examines maternal and child health across the life course with a focus on disability, equity, and the social determinants of health. Thanks so much for joining us today, Dr. Brown, and we look forward to your presentation. Thank you.
So today I'll be talking to you about some work that we've been doing on accessibility of pediatric healthcare to parents with disabilities. This is some work that's followed a long time spent looking at disability and pregnancy. And so it's been really interesting to sort of follow families over time and try to understand just how accessible or potentially not accessible the pediatric healthcare system is when a parent has a disability. So without further ado, I will get into it. So why do we choose to look at child healthcare? So we know from the literature that timely access to good pediatric healthcare is really critical, not only for individual health, but for population health as well. When children have good access to primary care and specialist care, it really presents opportunities for physicians to do standard monitoring of growth and development, undertake age-appropriate screening, and diagnose and treat illnesses as they're identified. There's really interesting research showing that even in Canada, children who do not have good access to primary care are more likely to experience chronic disease even decades later in life. So a really important opportunity to set children out on the best possible health trajectories. However, even in universal healthcare systems, we know that there are disparities in indicators of pediatric healthcare access. And these are often predicted by social determinants of health and structural factors such as poverty. But there really isn't a lot of research to understand whether parental disability might be associated with barriers accessing pediatric healthcare. So we've been doing research for about 12 years now on disability and pregnancy. And one of the most important statistics I think that we've been able to show is that about 13% of pregnancies in Ontario are to individuals with physical disabilities impacting mobility, sensory disabilities impacting vision or hearing, or intellectual or developmental disabilities. Now, this is quite in contrast with information previously. If you talk to obstetricians 10 years ago, I think the assumption was often that disability and pregnancy was quite uncommon. And so this point has been a really important teaching point that we've been able to use to show that healthcare providers in obstetric and pediatric healthcare settings are likely to encounter parents who have needs related to disabilities. I don't need to tell this group here, we know from decades and decades of research that healthcare settings can be very inaccessible to people with disabilities, whether we're talking about physical inaccessibility, communication-related inaccessibility, or even barriers related to physician attitudes and knowledge about disability. So that is well established in the literature. But what our team and others have done over the last few years is been able to show that many of these barriers extend, perhaps not surprisingly, to pregnancy and postpartum care settings, with individuals experiencing significant challenges with physical spaces, navigating obstetric settings, as well as, again, communication and attitudinal barriers with providers. So the question then follows, how accessible is pediatric healthcare to parents with disabilities? When we think about this question, one of the reasons why it's so important is because pediatricians and family physicians nowadays are very much focused on this concept of not just patient-centered care, but also family-centered care. And the idea is that if families are actively involved in the healthcare of their children and are engaged with a provider in a way that's equitable and respectful, that presents positive outcomes, not just for the child, but for the family unit as a whole. So this figure here is one of the ways in which we think about family-centered care, and that it's a partnership between a family and the healthcare provider that's marked by information sharing, so making sure that parents have the information they need about a child's growth and development, that care is actively and efficiently coordinated in a way that it's easy for families to navigate the healthcare system, that there's good communication between providers and families, and that those relationships are defined by respect. And so when we think about this, these are all hallmarks of good family-centered care. But what our team has found interesting is that there's really no specific examination of accessibility in these characteristics of family-centered care. And so I think this is a real opportunity to be able to identify ways in which pediatric healthcare settings could be more inclusive and equitable for parents and families with disabilities if we think about accessibility and parental disability in these contexts. So this was really the motivation for our study. So for the last, I guess, 2 or 3 years, we've been conducting this project that had two main objectives. Our first objective was to explore parents' current perceptions about pediatric healthcare and really to try to understand some of the barriers that they were experiencing accessing healthcare for their children. And I'll note here that sometimes I'll use the language of mothers with disabilities. When we started off this project, it was a follow-up project to some work that we had done on disability and pregnancy. And so when we did this work, we really focused on interviewing birthing parents with disabilities as opposed to partners that did not give birth to children. But I think an interesting follow-up, I think, in the future for this study will be to try to understand the needs of the family as a whole. But for this particular project, we really did focus on the birthing parent. And we interviewed both parents, birthing parents, as well as healthcare providers about their perspectives of the pediatric healthcare setting. And then our second objective was to take this information and to work with participants to try to identify strategies and opportunities to improve pediatric healthcare access and quality for families where a parent has a disability. So this is just a brief overview of what we did. I won't get too much into the details of the methods, but just to give you a sense of where we were situated. This was a large qualitative study of birthing parents that had physical, sensory, or intellectual or developmental disabilities living and receiving healthcare in Ontario. And we also interviewed healthcare providers, including physicians, nurses, midwives, and social workers in Ontario as well. We worked in collaboration with a number of organizations. You can see all the logos at the bottom, including Hydrocephalus Canada. So this was quite a community engaged project, and I'll talk a little bit about those partnerships in a moment. So our recruitment of parents with disabilities and providers was through organizations across Ontario for parents with disabilities. We worked quite a bit with our community disability advocacy organizations to identify potential participants. And then healthcare providers were identified through word of mouth with our team as well as through professional organizations. And the work was led by a postdoctoral fellow named Dr. Evelina Petuk and a peer researcher, Alexandra Rigo, who's here today and has already gotten a shout out in a previous presentation. So Alexandra's just been a fantastic member of our team. They did those interviews over about a year between 2024 and 2025. Like I mentioned, this work has been really in partnership with a number of different organizations. We really wanted to make sure that our research questions and the interpretation of our findings was informed by the needs of the community. And so we have an advisory committee that meets 3 or 4 times a year that's comprised of self-advocates, parents with disabilities, staff from disability organizations, as well as some health policy groups, including, I think importantly for this project, we're really pleased to be able to work with Children's Healthcare Canada as well as the Provincial Council for Maternal and Child Health. Both of these are really critical policy groups that determine a lot of the recommendations and clinical guidelines for pediatric healthcare in Ontario and nationally as well. And so the hope is that when this project is done, we'll have a set of really clear and important recommendations that can be used to improve accessibility of pediatric healthcare. So just to give you a sense of who participated in our study, we had a number of different people that were included, and I've sort of divided this into our group of birthing parents as well as the providers. So we had 32 birthing parents who participated, including 9 who had a physical disability, 4 with sensory disabilities, including vision and hearing loss, 7 with intellectual or developmental disabilities, and 12 individuals who had multiple disabilities in more than one of these categories. About 3/4 of them had multiple children, the remaining having one, and we were really focused on children less than 10 years of age with the idea that that's when parents are really doing, the heavy lifting of taking their kids to lots of medical appointments, and they're very much, in the room with them and an active part of their healthcare before they enter adolescence. On the healthcare provider side, we interviewed, I believe it was 15 individuals, including 6 physicians, 5 social workers, 2 nurses, some midwives, and some other health professionals as well. 40% of them had been in practice for more than 10 years, and about 40% of them had some disability training. And I just want to pause on that point. When we set out to do this research, we really wanted to understand the perspectives of a broad range of healthcare providers, including people who were already kind of bought into the notion that we should have accessible care, as well as those who might not be thinking as much about parental disability in the context of their clinical practice. But I think what happens oftentimes with these types of projects is that the people who are the most invested in the topic are they're most likely to participate. And so I think our sample is a little bit biased towards people who are already thinking about accessibility and parental disability. So I think in the future it would be really interesting to try to get a sense of, for the average practitioner out there, what their needs and perspectives are. So just a point to kind of keep in mind as we go through this. Okay, so I'm going to go through some of our findings. I will note that these are sort of hot off the press. Our postdoc who worked with our peer researcher to do these interviews has been on maternity leave for the last 6 months. And so this is sort of an overview of what we found, and we're excited to get more into the data when she returns. But I'm happy to report what we've been talking about so far. So I'm going to present some of the main barriers that were identified by birthing parents themselves, including fear of stigmatizing attitudes, physical inaccessibility of healthcare environments, communication barriers, and then some broader barriers related to costs and geographic distance as well. Okay. So, starting with fear of stigmatizing attitudes, this was, I think, by far one of the most common comments that we received from parents, regardless of disability experience. Many of them really worried about healthcare providers and how they would be seen in terms of negative assumptions about their parenting capabilities, or, excuse me, assumptions that providers would make if they didn't know them very well. And so this was Alice, who lives, and I should say that all of the names are pseudonyms, but Alice lives in a rural setting. And she noted that, where she lives, everybody knows me and I'm safe in this community. I've built a relationship with all the healthcare providers. So in my small community, I'm comfortable approaching doctors and nurses with whatever I need related to my child's health, truthfully and honestly. But she continued, but if I was ever traveling in larger city, I would definitely not take my child to a healthcare provider without able-bodied accompaniment. It's just because of stigma. And she gave an example. She said, my son had his foot cut open and he required stitches and he was bleeding. And I refused to go to the healthcare appointment because I was like, my child is injured. I know it's dangerous. And so I made my husband take time off work and go because I felt threatened because it was an emergency room and I was not willing to take a bleeding child into the emergency room by myself. And so I think that trust and relationship with healthcare providers was really critical. And when that wasn't present, there was quite a bit of concern about how families would be treated. So that's fear stigmatizing attitudes. Another one that was particularly important for parents with mobility related disabilities, as well as some with vision loss as well, was physical inaccessibility of healthcare environments. In our work on disability and pregnancy, we heard some really interesting and frustrating stories about parents who had babies who were born preterm who were not able to visit them in the NICU because there was no space around the incubator to be able to navigate wheelchairs or walkers in there. And what we heard from this study is a real continuation of that lack of physical accessibility in pediatricians' offices. And it's not just sort of what's there, but also about what is asked or not asked about access needs. So, our interviewers in this particular discussion with Ava were asking her about whether her children's doctors had actually asked her about physical accessibility needs before appointments. And Ava responded, never. I'm just thinking, even our doctor's clinic, they moved offices. It's not like she thought, oh, yeah, I've got clients with disabilities. Let's make this office better. It's actually worse than the old office. She said it's more cramped, which made it difficult for her to navigate her mobility device. The rooms, the examination rooms are just tight. They'll move a chair once I'm there. I think it's really not addressed in terms of any concern over their children's health because I show up with an able-bodied husband. I do think the care we get is different than what I would receive if I was out and alone with them. So again, a lack of preparation on the part of the healthcare system for making spaces equitable and inclusive for families with disabilities. Communication barriers were also a major concern. This came up primarily for participants with sensory disabilities, and I'll give you an example of that in just a moment. But I will note that it also comes up in relation to parents with intellectual and developmental disabilities, as well in terms of providers not always fully explaining their healthcare recommendations about the child and the parent really feeling like they weren't given the full information that they needed because it wasn't shared in a way that was accessible to them. For deaf individuals, a really common thing that we observed in their interviews was a lack of preparation on providers' parts in terms of making American Sign Language interpretation available. And there was also often an assumption that children would be able to act as an interpreter between the provider and the parent, which is not a good thing. That's not something that follows what we know to be important human rights in this context. So Amelia, who's deaf, described a situation where she was at a physio appointment for one of her children. She said, we were at a physio appointment because of my son's elbow. We went, no ASL interpreter. The therapist was speaking with the children, chatting at length. Nobody shared with me what the conversation was. Not one iota, not one single word. It looked like they were having fun. It was great that the therapist was engaging with the boys. Again, it's my right as a mom to know what's going on. I'm seated there and I feel like a fool, essentially. It's me. I have to make the choice to let that go and not be bitter and angry. I just have to let it go and try to think that I haven't missed out on anything. And so, this I think really illustrates where things could go wrong if a parent doesn't have full information about their child's healthcare. If recommendations about management of the child's health are being discussed, medication, all those things, it's a very basic need to have full access to that information as a parent. So we're seeing examples of where that's not taking place for these families. Costs were also cited as a reason. I think this is something that we hear come up in the population as a whole. And it was especially acute for many of the participants that we talked to, some of whom were on ODSP and not working. And so one individual, Chelsea, talked about her son seeing an occupational therapist and not having insurance to cover this. She said, I had to pay out of pocket. We're still waiting on funding 4 years later. And this is a situation where the son had a disability, so sort of an added layer of stress there as well. She said, but yes, he saw an OT so that I could do an assessment to get him his individual education plan, which was hard to get. Well, I couldn't afford to continue doing OT or occupational therapy. I mean, honestly, it was going on my line of credit for the most part, and I'm slowly paying it off. I mean, the last time he went was over a year and a half ago, and I'm still paying off the sessions we did. I mean, if I had a lot of money, if I could work, it would be easier because, of course, we could pay to see a psychologist or whoever that we would pay for, but that is totally not affordable because that's even more expensive than occupational therapy. So again, cost for these allied health professional services was also a major barrier. And then finally, one additional barrier that we heard about was geographical distance. And this was especially the case for families who had transportation barriers, including families where a parent used a mobility device and had to call, paratranspo or that sort of thing, and sort of this added barrier and issue of getting from place to place. So Addison talked about having a son who's autistic. She said he's the one that really has health needs. He sees a urologist in another city, in another province. She said, I'm lucky most of our appointments are over the telephone, so I don't have to try to get to that city. But saying that, when I do, it's hard to get to that city because I got to try to find somebody to take us. And it's 20 more steps than, what she turned a normal person. And that trip was every 6 months. And so again, I'd have to try to find transportation and somebody to take us and all that fun stuff. We don't have a pediatrician here in town. And because of all the other health issues he has, we have to try to get to City B. And then she talked about how for both cities, it's about a 5-hour drive from where she lives. And there are additional issues with trying to get travel grants, which only cover a fraction of the hotel. So again, some real practical barriers that could have been facilitated through greater support. As I said, we interviewed healthcare providers as well, and it was really interesting to see how the barriers to accessible care that they described kind of complemented some of the barriers that we heard from families. And I think some of these probably won't be surprising to this group, but we really heard a lot. And in all the research we've done on disability and pregnancy, I think Amy mentioned this as well in relation to sexual health, just a real lack of training for healthcare providers about disability and accessibility needs. Another barrier was kind of a lack of consistency in terms of they didn't have a strong plan of how they would address parental accessibility needs if they encountered a parent with a disability, and a real lack of infrastructure to support folks who wanted to do a good job in their healthcare practices but just didn't have the resources to do it. So lack of training. We talked to a mental health care provider whose pseudonym was Gianna. She said, in this example, she talks about a lack of training in relation to some specific types of disabilities. She said, we're not really that good at getting a sense of how people learn in the context of understanding parental needs in a pediatric healthcare appointment. She reflected even episodic disabilities, understanding that people might present one way at one time and then present differently at another time. She said there's not a lot of training with that. Like I said, lack of consistency or sort of lack of having a proactive plan to deal with accessibility needs was another piece. One person said, in one clinical role, I know lots about the parent because I'm actually their provider. In other settings, I don't know how to navigate conversations about parental needs. If it's an invisible disability or if a parent shares it, then we try to accommodate, but I certainly don't think we ask up front about parents' needs and how that might help facilitate their child's needs being met. And then finally, a lack of infrastructure. One family physician reflected, it really depends on the disability and the needs of the patient. We're accommodating within our constraints. Every provider has their own practice. So I just want to very briefly talk about some strategies for improvement. This is the piece that we're just starting to get into now, but I want to kind of give you a sense of the types of recommendations that we're talking about. One obviously being training for healthcare providers, and another being flexibility in care provision. So on the healthcare provider training component, we heard from parents, I do think that healthcare professionals need more training, working with people with disabilities in general, especially in the medical field, because there's definitely a lack of supports. And she said, it really makes me sad to think that that was my experience and that other people are experiencing that lack of knowledge as well. A lot of parents talked about the importance of flexibility in care provision, and talked about having providers who were willing to work with them and be more adaptable in their care provision was really, they were really grateful for it. So Caitlin said, I think people's willingness to adapt care can make or break anything, basically. I've had some nurses carry my kids for me from point A to point B. I think I had a nurse occupy my child while I was talking to the doctor. It's the people that make it work. It can be made to work if someone's willing to help you. So very last thought, when we think about these findings and what they mean for the future, I think we can think about our recommendations in a few different levels. We have the structural level where I think there's a real need to modify our healthcare structures and systems to make care more accessible, to have policy in place that requires care to be accessible. There's a real need for provider knowledge and resources that I think could be addressed through more systematic inclusion of disability in medical and nursing training. I think there's a need for accessible parental supports, thinking about, everyday interactions with providers and what can be provided to parents to make pediatric healthcare more accessible and easy for them to navigate. And then I think we need to continue to have more scientific evidence to provide, impetus for making these changes. As far as I'm aware, there are very few other studies that have looked at parental disability in the context of pediatric healthcare, so we definitely need more data to support these recommendations. And with that, I'll again thank our organizations that we've worked with, and I'll turn it back over to Shauna. Thank you.
Thank you, Hilary. That was very enlightening. Although I knew quite a few of those things existed just in my own, healthcare journey with spina bifida. It's still remarkable 30 years later that the same things are still happening. So
Yeah.
definitely
The need
need
for change.
more advocacy on that. And actually, over the summer, our summer student was doing a project. She was a medical student, and she asked other students how much information you get about our two conditions, and they all said very little.
Mhm.
And if real life experiences would help in the classroom, and they all said 100%. So
Yeah.
where you're going with this study is definitely in the right direction.
Thank you. Yeah, I think this data is just so needed to convince healthcare providers of the importance of that early training. And I'm so glad to hear you had a medical student working with you, because I think, even providing that experience to one person, once she graduates and she's practicing, she's going to be thinking about that in a way that maybe her peers haven't had the opportunity. So I think all those little things that we can do to provide even informal training is so important.